Hooty hoo. Anyone there? Nobody's gonna answer me. Chris?
I gotcha.
Oh. Chris, are you wearing your ugly sweater?
Hold on.
I mean, if Chris is wearing a sweater, then it's probably pretty ugly.
Ah, you did pack it.
See? Reindeer, longship.
Good job. Tyler, are you on yet?
What was that?
Oh, I was just wondering if Tyler with the state is, I saw
Yeah, Greg Lockwood's here, but yeah, I don't see Tyler on yet.
all right.
Ugly sweaters in tow as well.
You know, I missed the memo. I'm really sorry.
We got 10 minutes.
Yeah, you got time. Brian, I know you don't have your video on, but do you have your ugly sweater on? Hmm. Tyler, I see that you're on.
I am.
Can we try sharing your screen to make sure it works?
Certainly. Let me. Make sure. How is that?
Oh, perfect. That's awesome. All right.
Okay.
So on the agenda, the first special report will be with Dr. Brule from Search, and then the mayor will introduce you next.
Sounds good. I will stop sharing for now.
Okay, sounds good. Thank you.
Mhm.
So Chris, I'll do my best to call on you as well. A lot of times I find myself forgetting who's on, even though you're right in front of me on a massive screen. So if I ever skip you too long, make sure you jump in there so that we don't completely overlook your comments.
Sarah, can you hear me?
Is there a button you have to press to talk?
I don't know. Sarah, can you hear me?
I'm able to hear you, Brian. It's Chris.
All right. Thanks. I'll stand by for. Chris, has anyone reached out to you yet?
Sarah just texted me, said they're having problems and the power blipped. So I guess, yeah.
Okay.
Sounds like they're having problems on their end.
All right. Thanks. I'll stand by.
I told her you were trying to talk to her though. So I let her know.
Thank you.
Chris, can I get a radio check with you?
Yeah, I got you.
Okay, Brian, are you back on as well? And was DOT able to make it back on?
I am here representing DOT with the presentation. Tyler Bradshaw. Yep.
Thank you much, Tyler. For those online and in the audience, we are ready? All right. I'm glad that happened right before the meeting as opposed to in the middle of it. That'd have been much more awkward. So thank you to Sarah and Centennial staff for getting us back online. I will go ahead and call to order the regularly scheduled meeting of Tuesday, December 12th, 2023. Please join me for a flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The Assembly of the City and Borough of Sitka would like to respectfully acknowledge the traditional first people of Sitka. With gratitude, we proceed on Tlingit Ani. Sarah, roll call, please.
Mayor Eisenbeis,
Present.
Mr. Mosier,
Here.
Mr. Pike,
Here.
Mr. Yestad,
Here.
Ms. Carlson. Here. Mr. Saline,
Here.
and Mr. Christensen is absent this evening.
Great, thank you. Any correspondence or agenda changes this evening? No ceremonial matters. That'll bring us to special reports. We have two scheduled special reports this evening, starting with Search, a home health care update. Please, Doctor. You know, backup is always appreciated on your part, I'm sure. So.
There, can you hear me okay? Okay, so I'm Dr. Elliot Brule, citizen of Sitka and Chief Medical Officer for Search. And thank you for inviting me to come and give an update about home-based care. Okay, is that better? Okay, let's see if I can, let me see if I can run your computer here. So in the past, there's been a freestanding home health department. It's had an independent administration, independent quality assessment and quality improvement. Requirements of providing care within that context meant that we had a staff of 8 employees, professional employees to do that. We inherited that program as part of the asset purchase agreement with Sitka Community Hospital and operated it for 3.5 years. During that time, we had multiple surveys from Center for Medicare Services, which is called CMS, and also from Joint Commission, which is an organization that ensures that our services are compliant with Medicare rules. And we've maintained a Joint Commission accreditation in that context and also for all of the other services that we provide. The services that were provided in that home health setting are listed there, and you can see they're quite extensive, including individualized care plans, personal care, wound care, education for patients, including training and teaching for tracheostomies, colonoscopies, colostomies and ileostomies, as well as end-of-life support in collaboration with Braveheart volunteers, as well as Center for Community and SAIL and the Pioneer Home. This is some representative data from 2021, 2022 with respect to the visits that we had in the home health department. You can see physical therapy, skilled nursing visits, which are provided by a registered nurse, occupational therapy visits, the overall census, which is the total number of patients, and then deaths, which run between 0 and 2 a month generally. In summary, the average demand for service is about 80 nursing care visits a month, 100 physical therapy visits per month, or 50 occupational therapy visits per month. This year, we made an adjustment to the way that we staff and provide that care. So we continue to provide the same services. We have dedicated nursing staff, which are based in the clinic. We have dedicated physical therapists, occupational therapists, and speech language pathologists, which are also based in the Mountainside Rehabilitation Clinic. And we've adjusted staffing levels to be consistent with the demand for services. So demand for services generally for licensed nursing care is about on average 20 visits a week. And for physical therapy, about 25, and occupational therapy, maybe 12. So a staff of 8 professional staff is, it's a really very heavily staffed approach to providing that care. So we've adjusted that by providing that care within the clinic down to 4 staff. So 1 registered nurse, 2 physical therapists, and occupational therapist. These are the services that we continue to provide to patients who need care in their home. And you can see that all of the same services that were provided previously in home health continue to be provided by our staff in home-based care. The home-based care that we're providing right now is compliant with and consistent with the regulations from Center for Medicare Services. So those regulations apply to all of the services that are delivered in the home, as well as to all of the other services we provide. We are Joint Commission accredited in all search programs in all locations, with the exception of long-term care, which is directly accredited through CMS. That's a difference in regulations. The care that we provide in the home-based care is covered by Medicare and is billed directly to Medicare. Medicare services reimburse outpatient care in rehabilitation or with skilled nursing at 80%. So that means there's a 20% copay. That 20% copay for those services is covered by coinsurance. So the vast majority of the patients that we serve have insurance in addition to Medicare. So something like Aetna or Blue Cross Blue Shield that cover that copay. For people who do not have secondary insurance, we have a sliding fee schedule. We have a sliding fee schedule which is available to all patients in all locations and for every service that we provide. So somebody who is financially unable to pay for their care, we assist them to access to access the sliding fee schedule. And that's not just true with home care, that's true with everything we do. We maintain collaborative relationships with the Pioneer Home, with Braveheart Volunteers, for Center for Community, and with Southeast Alaskans for Independent Living. So we've had those relationships pre-existing. We continue with those relationships. We provide home-based care services within the Pioneer Home to our patients that are residing there. We work with Braveheart Volunteers, which is a fabulous organization. Very proud to say that I was one of the people who founded that organization about 20 years ago. I served on their board for a number of years. And they are essential in terms of the fabric of care that we provide to people at the end of life. Center for Community is an organization that assists with non-licensed care. So if somebody needs like a home attendant, Center for Community is really the organization that helps us to be able to provide a non-licensed care attendant or CNA. And then Southeast Alaskans for Independent Living is an organization that assists with equipment, things like a shower chair or maybe a ramp into the house. So in summary, Search is committed to the healthcare of all persons in Sitka. We're committed to the healthcare of all persons that live in all 27 communities that we serve. Search is committed to the care of patients who are homebound in Sitka. Search home-based care provides all of the same services that were provided in the past by Home Health. These include social services, skilled licensed nursing care, physical therapy, occupational therapy, and speech language pathology. Home-based care is provided by skilled, trained, licensed professional staff, and it's CMS compliant. And home-based care staffing in this setting is commensurate with the demand for services. I did provide to you a one-page cheat sheet that is the information that we provide to patients regarding reimbursement for these services. I also would like to ask your indulgence and also respond to some additional questions that I've received from the community. So one of those questions is, what is Search's definition of home health service? So our definition is providing licensed professional care within the home to patients that are homebound, unable to provide or unable to leave their homes, and that we provide that at a level of staffing that's consistent with the demand within the community so that it's sustainable in the future. How many staff, specifically RNs, administrative, were employed by the now closed home health department? How many dedicated staff are presently employed for home services? So as I explained previously, there were 8. Now there are 4. Does Search still have its same as before closing the home health department home care accreditation? As I mentioned, all the services that we provide are accredited, are compliant with Medicare regulations. The program does not have the context or the existence of a home health agency. So home health agency is a dedication, is a designation within Medicare that is has specific requirements for administration and maintenance of records and other regulations, and that is really the reason that our staffing in that context was so high. So, having 8 staff in order to perform care for about 20 visits a week. So that's the reason for the change. And like all businesses, we have to adjust staffing to reflect the demand for services. I think anybody who's in business understands that. What values were driving the decision to close home health, and what vision of healthcare was driving this decision? The values that are expressed in our change is the value of maintaining sustainable healthcare, the value of providing care that is proportional to the demand within the community. There's lots of things that we would like to be able to provide. It'd be great if we could provide dialysis. It'd be great if we could do neurosurgery. There's just not enough demand for those services to justify staffing in that manner. We adjust staffing all the time. We've been increasing our staffing in behavioral health to reflect the fact that there's a tremendous demand in this community for behavioral health that's not met. We've more than doubled our staff in behavioral health in the last 2 years. We have adjusted upwards our staffing in substance use disorder treatment. We've more than doubled the size of that program to reflect the demand for those services. We have added a clinic to treat opioid use disorder. The reason for that is there's demand for those services. We have added a large number of specialists here in Sitka in order to meet the demand for specialty care close to home. So adjusting our staffing to reflect the demands within the community is really a pretty straightforward and understandable act within any business. Considering that home health services are regulated by the state and federal government in order to qualify for Medicare coverage, who will pay for home care services rendered by Search when those services are no longer regulated? Well, the services that we're providing are compliant with Medicare regulations and are reimbursed by Medicare, and most of the patients that we serve are Medicare qualified. So that's where the payments are received. And then there's, as I mentioned earlier, about a 20% copay that's covered by insurance. Has the very specific nursing experience and expertise provided by the staff of home health been lost? And the answer to that is no. The services that are being provided right now in the home to patients are being provided by the same staff that were providing services in the past. Is Search planning to provide palliative care as we face end-of-life healthcare challenges in Sitka? Is Search planning to take another look at creating a Medicare-funded hospice facility in Sitka? The answer to that is we have looked very carefully at the possibility of providing a hospice facility in Sitka. I wish that we could. I wish that it existed. There is not a volume of patients that need that service that would be able to support the really tremendous amount of work and staff work in order to maintain a Medicare style hospice. That does not mean that we don't provide care for people at the end of life. It just means that it takes it's a more complex a fabric that has to be woven in order to support those people. So it means that our staff provide the skilled nursing care and It means that our organization, Braveheart Volunteers, support the patient and the family with their emotional and spiritual needs. It means that Center for Community supports that patient with a home care attendant. One of the things about the old home health services designation is that it's actually has some pretty tight requirements in terms of which patients qualify for those services. And the thing about the home-based services that we provide now through our outpatient clinics is that those restrictions don't apply. So what we're seeing is actually an ability to provide an increased variety of services to people that otherwise wouldn't be served in the previous home health context. So I asked Bill Spivey, who is our search-wide director for rehabilitation clinics, to join us and talk a little bit about that, as well as Cody Skilling, who is our regional director here in Sitka for outpatient services.
Absolutely. Thank you. I'm Bill Spivey. I'm a Sitka resident of about 20 years or so, and I have been a physical therapist, and now I'm, as Dr. Brule mentions, the rehabilitation services director for the consortium, and still very connected to the care that our teams provide across the consortium. And here in Sitka, the opportunity to provide home-based care for me and for my team is actually, I have been excited about that opportunity because it's allowed my teams to do things that historically we were not able to do. There are services for pediatric patients. There are services for postpartum moms who cannot get into and bring their families with them to the clinic that we can go to the home and see. There is a growing group of physical therapists and occupational therapists within our national organization that are defining services that we can provide at end of life that previously we would not have typically provided in a home health setting. And so we are currently involved in those activities as well. So and beyond the physical therapists that were specifically dedicated to our home health agency, now my entire rehab staff has gone through the training and is prepared so that if I have a patient who I'm seeing in the clinic on a regular basis that for one reason or another can't make it to the clinic for appointments, I can go to their homes and see them now so they don't lose track of the progress they've been making. So for me, it's an exciting opportunity.
Absolutely. Thank you for having us this evening. Cody Skilling, I've been here about 5 years in Sitka. And speaking for primary care, we're very excited to have the service line within, embedded within our clinic. There's a real touch within our providers, working with our nurses directly to provide these services, and it helps to have that in the clinic. And so, we're excited to create redundancy in training and staff to help make sure that we're continuing these services within primary care.
And there's some services that we've been able to provide now that we weren't able to provide previously. Maybe you could mention a few of those.
Yeah, absolutely. We've got a great opportunity to provide, immunizations is one great example for patients that, wouldn't normally come to the clinic to get immunization, as well as lab draws, to where, we can kind of same day go out there and take care of that, within a regular outpatient visit.
Thanks. What is the real reason behind the canceling of home health? Is it because Medicare does not cover the full charges, so it isn't cost effective? The home health department or agency no longer exists, but care of patients within the home has continued. It has not stopped. It didn't stop. Everyone in this community who requires that care that we're aware of is receiving it and is continuing to receive it from licensed professionals in a setting that's compliant with Medicare regulations. Will Search provide any CNA services for personal care? The answer to that is no. We haven't done that in the past, and it's really not part of a home health program. Those services are arranged through Center for Community. What services exactly are available today, such as labs, wound care, medication management, case management? All of those services are available. Are social services available to assist patients that can't afford copays? The answer is yes. We have financial advisors and people that are available to assist folks in accessing the sliding fee scale. Is Search afraid that Sitka elders will tend to want to move away because they can't afford Search's home-based services? The answer to that is no, we're not concerned about that. We're working to increase the availability of care for people in their later years. We've been expanding our long-term care facility, and we're committed to continuing to provide care in the home to anybody who needs it. I guess one of the questions that that people have is, why wouldn't Search choose to show up at a public meeting to discuss this, or why wouldn't we choose to work with the community in other settings? The answer really has to do with our commitment to process at the time of the asset purchase agreement. So what was set up at that time was something called the Sitka Community Health Council, which has met quarterly for the last 4 years, every 3 months. Membership on that committee includes 3 members of the City and Borough of Sitka, the city administrator, and currently Dave Miller and Amy Ainsley. It includes 3 members from the Sitka Community Hospital Board, or designated for former members of the Sitka Community Hospital Board. That includes Marianne Hall and Dr. David Lamb. It includes 2 members from Sitka Tribe of Alaska, Mr. Fred Olson and Rachel Moreno, and it includes 3 at-large members from Search. Lastly, I'd like to take a moment to thank our staff. So we have a wonderful professional staff who are dedicated to the work that they do, are dedicated to providing care to the people of Sitka. Coming forward here in the next few weeks, many people will be at home enjoying their holidays, and our staff will be working hard to take care of our patients. Many of our staff have been confronted in some very aggressive ways about questions about these services, and in ways that are very depreciating in terms of their commitment, and depreciating in terms of the quality of the care that they provide. Our staff deserve all of our respect and kindness and appreciation, and I want to thank them publicly at this point in time. So again, thank you for inviting us to provide more information about our home-based care program, and I'm happy to take your questions.
Yeah, thank you. I appreciate your time this evening and coming to excuse me, to get your side of the story out. I appreciate that because it does sound like you have quite a PR issue on your hands right now. So I look forward to Search continuing to get the word out about this continued services and the new existing services, because I think the angst in the community is very high right now, and I think that's on you to try and ease some of that as much as possible. So we appreciate this step in coming here and getting this out, and I hope that it's the first of many around the community. Thank you.
Thank you.
Yeah, please, JJ.
Thank you for coming. This is very informative and helpful, and a great way to get out to the people in the room and the people listening at home. I had a question about, this is your new program's called Home-Based Care. And you have here in your new approach slide, you have dedicated staff that's clinic-based. So how can it be home-based and clinic-based at the same time?
Thank you for the
Mhm.
question. So what it means is that it's processed. The care is being processed through the clinic environment rather than through a freestanding home health agency. So we have outpatient clinics, like one of them is in the hospital. It's called OPD. Another one is Sitka Medical Center. And those clinics have staff, and those staff support these activities for skilled nursing. So the nurse case managers, the social workers, the people that counsel people about their financial support, et cetera, are all based within those clinics. With regards to rehabilitation services, those services are headquartered out of our Mountainside Rehabilitation Clinic. So that's
people don't have to go to the clinic?
No, they don't. So
anyone that requests that is certified homebound can get
Yes.
services in their
Actually,
house.
they don't have to be
Even
certified
certified as homebound.
homebound
Even-
anymore.
That's
So as
fantastic.
Mr. Spivey was mentioning, what we've been able to do with this program is extend care into the home environment for anybody who needs it. They don't have to go through a certification process, and our staff can, at the request of the patient's physician, or if they simply call and need some service, we're able to go to their home and provide that.
And what's the wait time on that?
It's virtually none. Cody?
Yeah, so the process really is, driven, through the provider and the case management team, to where we have, obviously a dedicated case manager that will go out to the clinics. And, just speaking in terms of demand and volume, looking at that 4 patients a day. So if you've got, one nurse dedicated to that, theoretically, same day access it should be available. And, that's really our goal with that. So.
Yeah, absolutely. Thank you. The system as it exists, again, not actually very different from what home health was designed, where if I gave you a specific example, you're in the hospital, you've gone through an acute care stay and you're about to discharge to home. Our providers in the hospital setting know that you are going to be homebound. They know that you are going to continue to need services. And so the email goes out from the acute care staff to our scheduling staff at the outpatient clinic and says, hey, Bill Spivey is discharging on Friday and he needs to continue to receive care, and they're scheduled.
Thank you. So with your new staff of 4, and you have dedicated nursing, PT, OT, speech language pathology, is that one of each?
The demand for speech language pathology is so low that if that was needed, it would be pulled in. It's infrequent. So there's 2 physical therapists, 1 occupational therapist, and 1 registered nurse. Yeah.
So if someone was needing end of life support, it often takes 2 people to turn someone. That would be the 2 physical therapists going every 2 hours to a home to turn someone.
There's, as I mentioned, there's a sort of entire group of people that are pulled in order to be able to provide the care to a patient who's dying at home. So some of that would be a care attendant that would be arranged through the Center for Community. Some of it would potentially be additional staff out of the outpatient clinic. If you can talk to that.
Yeah, it's a great question. With having just 1 dedicated nurse to that, we would like to continue to kind of create, a team in those situations to where we can go and have, extra set of hands to help specifically with end of life care, to be there to help with those specific situations that we can, kind of bulk the staff a little bit for those particular spots. Yeah.
So that's a goal and a room for growth that you guys have outlined.
Absolutely.
So with this 2 OT, 2 PT, 1 OT, and a nurse, is that an RN, an LPN? What type of
It's a
nurse do you?
registered nurse.
So what about prescriptions? How are they allowed to, if, I broke my back and needed some pain meds, do they come in the mail? How are these delivered to the home health environment?
They can be delivered by our staff or by the pharmacy staff. And yeah, we're fortunate in this community that White's Pharmacy and Harry Race assist with that. And if the prescriptions through Mount Edgecombe can be delivered by our staff.
So this program transitioned several months ago. Is there anything you wish you would have done differently in that transition?
Oh, well, I think that it's been really a very disappointing process. I mean, I know it's been disappointing for a lot of people who are, concerned, and I think they're rightfully concerned about whether or not they're going to be able to have care, as they grow older. And I think that's understandable. I think, I guess what I would say, I mean, to be really honest, is that we have a fault line in our community. Now, I've lived here for most of the last 30 years. That fault line within our community goes back probably 80 years, at least, to the time when, the Mount Edgecombe campus was first built and was built for the purpose of caring for military people, and then transitioned to the care of Native people, particularly with the tuberculosis outbreak. And that situation created a situation where people in the rest of Sitka did not have care, but saw the care was happening over there, which generated a lot of anger and a lot of resentment. And so the people in Sitka, developed their own hospital. And so then we had basically the equivalent of a Jim Crow healthcare in this town, where there was care on one side of the bridge and care on the other, and the division was along native, non-native lines. What happened in the 1970s is there was a law that was passed that allowed for the tribes to create a private company, which was Search, and of course we know that Ethel Lund was one of those leaders. And then there was a bridge built across the channel. And so people wanted to go across that bridge and get care. And that created a lot of anger and resentment in the people in the medical community on this side of the bridge, because they felt that that was going to destroy the integrity of the hospital. And there was threats of lawsuits, and there was anger, and there was rancor, and there was a loss of trust within the community, and a reinforcement of that wound and that fault line. And then there was an MOU that said you could get care if you were non-native at Mount Edgecombe, if you already had a chart there. But if you didn't, you couldn't. And so that created anger and resentment. And then there were people who, within the Native community, who were fearful of losing their services because of that, understandably. And that created more anger and resentment. And then, Sitka Community Hospital, and I worked for Sitka Community Hospital for a while. Sitka Community Hospital struggled the way that small hospitals struggle all over the country, and ultimately ended up failing financially and being sold to Search, which created a lot of anger and resentment. So we have this fault line within our community. We have this pain that is not healed. There's a lack of, I would say that the situation that's occurred here with this transition probably is some measure of the lack of trust, the accumulated bitterness and resentment from those years that our community has inherited. So on the one hand, as a business, we have to be able to adjust as we go forward to, have our staffing and the way that we provide services reflect the need for those services. And we are going to continue to do that. And there will be more changes that will come as the healthcare system evolves here in our community. On the other hand, as a community, we have to find a way to heal. And in healthcare, the only way that you can have healthcare is if there's trust. And without trust, healing can't happen. So I suppose, as I think about this, I think that, the only way that healing can happen is with time and the trust that's built up one patient at a time between the the patient and their clinician. So it's a little bit of a long answer, but I think it's really, how I would characterize sort of the problem that's occurred here. And I have no illusion that the factual information that I presented this evening will mollify some of that anger and resentment. But I do, we are definitely committed to continuing with the Sitka Community Health Council. Once a year, we open that meeting up for public testimony. The last couple of years, there's really been nobody that's shown up to do that. The next meeting of that health council is in the end of January, on January 31st. I certainly, and that meeting will be a meeting where there's an opportunity for people to express their concerns, and I certainly hope that they will.
Great, thank you. Thank you, Mr. Mayor.
Again, appreciate your time this evening. Thank you. Tyler of PND, thank you for your patience as we navigate a community issue here. And I thank you for your presentation on this next community issue that we take up. So I appreciate your update on the Seawalk project as we move forward.
Absolutely. Thank you for having me. Give me just a second while I share my screen. Oh, it's telling me I can't share while somebody else is sharing. Oh, there we go.
And we got you now.
Got me now, and everybody can hear me okay?
We can, thank you.
Fantastic. Thank you, Mr. Mayor, Assembly members, for having me this evening. My name is Tyler Bradshaw. I'm with P&D Engineers over here in Juneau. I'm here to provide you with an update on the Sitka Seawalk Phase 2 project and answer any questions you may have on it. Start with a little project background. I would imagine most of you know this is a joint project between the City and Borough of Sitka and the Alaska Department of Transportation and Public Facilities. DOT is managing my engineering team, as well as the future construction of the project. And then we have several consultants on the project listed there. If you'll recall, the Sitka Seawalk Phase 2 project is intended to connect the existing seawalk, which ends over here at the public library currently, with the Totem Square Lincoln Street area over here. It's intended to be constructed in 3 sections. Section 1 is this one here, shown in red from the public library to a bridge approach here at Harbor Drive, going over to O'Connell Bridge. Section 2 goes the outside of the bridge approach. That's the section that we're most interested in at this point in time. Goes outside of the bridge approach, and Section 3 comes along the lightering facility here, O'Connell Lightering Facility, and then connects into Lincoln Street, Totem Square area here. Section 2 is intended to be constructed first. It's the largest of the 3 sections of projects and the one currently without any pedestrian facilities, at least in the area that we're proposing. And so that is intended to be constructed first in the area that I'm going to be discussing primarily this evening. So just a little bit of background on what we've been doing with the Phase 2 of the Seawalk project. We completed preliminary design of all 3 sections. That was done in fall of 2022 last year. And we completed an initial public meeting and public outreach in the fall of 22 on into January of 23. And as a result of some of the input that we got on that public outreach, we completed an investigation of a rock wall that was discovered in the intertidal zone adjacent to our project. That was done in February 2023, and it was determined that the rock wall is actually outside of the project area, and we won't be impacting that historical artifact there. And then also as a result of some of the public input we got, we revised the Section 3 area in the spring of 2023. And then on into now, we've got environmental review and permitting ongoing, and we're coordinating with the Sitka Tribe of Alaska on a few items. That's ongoing, as well as the design of the Section 2, which is the one that's going to be constructed first. A little bit of a recap of the public engagement process we had with the project. Again, the public meeting we had was held on November 30th in 2022. We had a comment collector, an online comment collector that was open from November 10th to January 4th. We received comments via that comment collector and via email to the DOT project managers. Here's kind of a summary of the comments that were received. 11 were in favor. Kind of the themes that were in those in favor comments were safety, walkability, and accessibility. There's a few quotes over here that kind of encapsulate what the majority or what some of those comments were over there that you can read on the side of the slide here. We had 8 comments on the other end of the spectrum were opposed to the project. The themes we saw most prevalent in the opposed comments were valuing the visitors and the tourists over the residents of the community. There was some concerns with the habitat and cultural impacts, habitat being the heron spawning area and the eelgrass there, and the cultural impacts being the rock wall in the area were the ones that were listed, and then cost was another theme. The remaining comments were what we would call neutral. Most of them were design suggestions, and then several were related to the radio station. The project is adjacent to the satellite dish that KCAW uses as their connection, and also the cable house. So a lot of folks were saying, don't interrupt our radio. So those were the comments that we received mostly through the public engagement process. As I mentioned before, the public process resulted in some changes to the Section 3 layout that we completed last spring. This was the layout that we brought to the public meeting. And even before the public meeting, we had some comments that said, why are you going along this Harbor Way here? This was a result of some earlier scoping efforts that were done in the 2018-2019 time period before I came on board. But even before this public meeting that we just had last fall, folks were saying, why don't we do this out here? And so we put the question to the community at that time and said, hey, do you like this layout, or would you like to see a path that kind of went along this sidewalk? If you look at this picture out here, there's an existing sidewalk under the bridge there that kind of borders the shoreline there. And we got a resounding do it this way out here from the public comments. And so we revised Section 3 to go along the outside. Another comment we had was to kind of open up this plaza area at the lightering bridge. This is just a placeholder. This hasn't actually been designed, but it kind of shows the intent to maybe open this up and do something more inviting for the lightering facility. And then the other area that we talked about was this intersection at Lincoln and Harbor Way here. We kind of put the question to the community, how would you like to see this end, the Seawalk end here, either going across this crosswalk here at Harbor Way onto Lincoln Street up here, or going across Lincoln Street and trying to kind of tie into Totem Square. Most folks liked that option better. And so we did put some effort into design going across Lincoln Street. You can see over here, we've got a crosswalk in here, and then you've got some sidewalk. It's a little bit lighter colored over here. The intent would be to replace these Jersey barriers or remove them and have some seawalk along this side and tie into the handrail. So you have some seawalk and some handrail over here that ties into the sidewalk and handrail that's over here along Totem Square. The reason that you see this in a different color is because CBS is engaged in planning for a Lincoln Street project. So both that Lincoln Street project and this Seawalk project in Section 3 are future projects. So nothing set in stone yet, but right now the Seawalk project ends right here at this intersection with the plan for the Lincoln Street project to pick up this extra piece that we laid out here with the Seawalk project. But we did respond to the comments there that we received regarding this area. What does it look like now? Well, now we're focused on Section 2, which is the section that is right outside of the O'Connell Bridge approach there. So you can see in my plan view here, this is the bridge approach here. This is the Seawalk along here. On the outside of the approach, and it ends over here at the lightering facility here. Beginning right here at this existing sidewalk that's there, we're going to tie right in, and we go into this lookout node that we've got here, kind of adjacent to the insurance area parking lot there. This is a seaweed pattern designed by local artist Tommy Joseph in conjunction with Monique Anderson, our landscape architect, gave us that design. That's how it presently looks. And then it ends over here. Again, this is just a placeholder. This is not actually part of Section 2, this area with this plaza. Section 2 ends right here, kind of adjacent to the restroom facility that's under the bridge. We have 3 other lookouts that are along this so you can enjoy the view there that are here, here, and here along the outside of that bridge approach. It's going to have some bench seating, and I do have some slides here that show this a little bit better. I'll get to in a minute. But it has some seating in here and some lighting, some interpretive signage, and some handrail along here. You'll see that we're just showing this as a colored band right now. Your current Seawalk has that brick inlay in it in other parts of the Seawalk. We got some feedback from the Sitka Maintenance Department that they're having some trouble with maintaining that brick, and there's some settling issues with it. So right now we're planning to just do a colored concrete band, so you kind of maintain the similar feel, but not having the same maintenance issues. But we are paying homage to that basket weave pattern that you have with the brick inlay. We're going to put it in the face of these concrete walls that we have on these 3 outlooks here. I understand some of the other questions that the assembly had when this was discussed at the last meeting was related to the fill limits that we're looking at for the section 2 of the seawalk. So I've developed these kind of graphics here, and I'll walk you through them. This red line here along this plan view shows where the existing toe of the fill is with the current bridge approach, and then the gray big bold black line and the gray hatch shows where we're planning to go. And kind of the biggest fill areas is up here in this corner where you don't have a lot of fill along the shoreline, and we're pushing out a little bit, but above kind of the intertidal zone there, it's about 15 feet. Best case scenario, kind of right along here where those lines get real close, that's about 2 feet. On average, we're between 8 and 9 feet out from the existing toe of the fill there. The way that we were able to do that, if I can bring you over here to the section view we've got, is we steepened this Armor Rock slope up quite a bit. It's a 1 1/4 to 1, which is about as steep as you can go with the big armor that you need protecting the facility out there. Most of the slopes out there have a little bit more gradual slope, not all of it. Some of it's very steep, the existing slopes, but a lot of it has a more gradual slope. So when we come off the top and have this steep Armor Rock slope coming down, we're trying to catch these toes as close together as we can keep them, and that's how we're able to minimize some of that fill. There is an eelgrass bed, that's this big green area that's out there that you'll see when the tide is down out there. We are impacting it a little bit. It's about 41,000 square feet right now. We're taking about 2,200 square feet of that eelgrass bed with this fill area. Here's a shot of the view of Crescent Bay that we anticipate you having from the new seawalk, kind of restoring that view that the bridge that was put in lost, and allowing folks to kind of walk out here and see the lighthouse and this great view that it's got out here. So you can see the seawalk and the striping here and some of the amenities that we've got, bench seating, interpretive signage, and you can see that basket weave pattern in the wall that we've got out there, and some landscaping that's going to be all along the edge of the whole walk. Also the lighting that will be all along the whole path on the outside of that bridge approach. There'll be a well-lit path. Here's some of the design elements. We'll have interpretive signage, and as I mentioned, we've committed to having an educational sign about the eelgrass. So we'll have something, it won't look exactly like this most likely, but something similar. This is one I think that's on another area of the seawalk. Educate about the fish habitat that's right out in front of the seawalk there. We'll also be working with the tribe. Rebecca Paulson is one of our local artists that's working with Monique Anderson, our landscape architect, to develop some interpretive signage. Here's just a sample of something they've been kicking around, but that's under design, not fully developed yet. Still working on that with our design team and the tribe. We'll also have the wayfinding signage that's prevalent along the seawalk in Sitka. We'll be updating some of those around the project area. Bench seating, trash cans, of course, and some lighting along the seawalk there. One of the other things that we received some comments on in the public meeting last year was around Maksutoff Way and some of the concerns with the tourists going down that kind of private roadway there that leads to some of those residents. So we are looking at, with this project, even though it's a little bit outside of the Section 2 project area, with this project, we're looking at providing some sort of signage to kind of deter some of the tourists from going down that private walkway and violating some of the privacy that we have down there. So we're going to do what we can to deter folks from going down Maksutoff Way off this seawalk. One of the other questions I understand that the assembly had from the last meeting was ongoing maintenance costs of the seawalk. CBS is responsible for the path and the amenities. DOT is responsible for the fill and the armor stone. CBS provided us this slide that estimates the ongoing annual maintenance cost of about $5,600 down here, and you can see what they've got listed. What's upcoming for the CWAC Section 2 project? We're planning a second public meeting to kind of design updates similar to what we've got here for the general public, late January, early February time period. We'll be coordinating with the Sitka Tribe of Alaska on the environmental document that DOT has been working on. We're hoping to have that completed mid-January to late January. We're also working with the tribe on the interpretive signage. Monique and Rebecca Paulson will be working on that with the tribe. We hope to be complete with the environmental document, as I mentioned, in late January, and then proceed into permitting. I mentioned this is critical path because permitting in intertidal zones can be a cumbersome process and take some time. We're hoping that we stay on schedule, but that is an item that's kind of a question mark. But if everything goes as planned, we'll proceed into Section 2 final design after the environmental document is completed in January, and move into permitting concurrently with final design, and then looking at construction in late 2024, 2025. The work that will be ongoing will observe any fish windows that the agencies require with the project, and herring season and the other species that may be impacted by the project. And we're going to aim to avoid any tourism conflicts with the peak tourist season as we're constructing this project. And that is all I have for you today. I appreciate you allowing me to present to you, and I'm happy to answer any questions you may have on the project.
Thank you, Tyler. I do appreciate that. It looks like the project's coming along well, and I appreciate your work on it. Questions for Tyler from the assembly? We don't have any on this side. So once again, I appreciate your patience in staying with us this evening, and thank you for your time.
Thank you.
Before we jump into the rest of the evening, it has been over an hour, so we'll take a brief recess, and then we will continue on with persons to be heard this evening.
What's that?
Chris, did you have the opportunity to come back yet?
Yep, I'm here.
Gotcha. We'll get the show on the road in interest of your and our time. Well, welcome back, everybody. We will be moving on our agenda this evening to persons to be heard. This is public participation for any item off the agenda, not to exceed 3 minutes for any individual.
My name is Sue Littman, and I'm going to read a letter to the editor that was in last night's Sentinel. When Search announced the closure of their Medicare Certified Home Health Department, Dr. Brule was quoted on Raven Radio. Brule says Search is closing the office mainly due to federal regulations that make operating it challenging and inefficient. He says the regulations are directed at larger cities and larger hospitals with more resources that can more easily sustain full home health programs with separate medical staffs. I would kind of describe it like building an international airport in a location where what you really need is an airstrip, Brule says. Petersburg Medical Center has had a Medicare certified home health care agency since 2006. They say the department does not make money and that the regulations have increased over the years. However, they emphasize that Medicare certified home health care is a vital component of the health care they provide to the residents of Petersburg. Sitka has almost 3 times the population of Petersburg. How can Petersburg's hospital provide Medicare certified home health care to their residents when Search cannot? And Search has said that there's no gaps in services to their patients, but Mary Beth Paloff, who is a Braveheart volunteer, said that I can tell the assembly that the person she visits has seen their home health care fall through the floor. And I guess I have another comment. When Search was talking about their home-based services, seeing people that don't qualify for Medicare certified home health, I'm guessing that they probably could have a program like that in tandem with their Medicare certified home health department if they wanted to be able to see pediatric patients or whatever. But anyway, thank you very much.
Thank you, Mr. Mayor. Thank you, Assembly, for providing us with this opportunity. This is my letter to the editor to.
If we could get your name for the
Oh,
record,
I was going to
please.
say it in here. I didn't want it to count against my 3 minutes. My name is Elizabeth Faulkner. I'm a registered nurse. I've lived here in Sitka for 30 years. Thank you. Give me back my minutes. This letter is to share my disappointment in Search's decision to close our certified Medicare home health agency after almost 40 years, especially as our population is aging. I've been an RN for almost 40 years, with 30 of those years in the specialty areas of home health and hospice. I have worked in 3 different states, and I was a manager of Sitka Community Hospital from 2004 to 2015. I find the reason stated for the closure of home health to be faulty and frankly unbelievable. The regulatory burden is there to protect our patients and our organizations, ensuring consistency and continuity of care. It ensures that a quality of care is maintained for all, no matter what your color, creed, or race. The reported 16 home deaths a year was referred to by Search as a small number. That does not seem to be a small number to me, considering the size of our community. The report of 120 home visits per month was referred to as a small number. Considering that we have been through a worldwide pandemic, most industries are just now recovering. CMS instructed home health agencies to only make necessary visits to decrease the chances of exposing our vulnerable elders to COVID. The numbers are not a true representation of the actual community-wide need for home care services. A certified home health agency provides an initial head-to-toe assessment, including complete medication review, psychological, social, emotional, and spiritual assessments, advanced directives, home safety evaluations with recommendations and referrals, pain management and evaluations, education and evaluation of disease processes, case management and coordination of care between patients and their doctors. A detailed individualized plan of care is established with periodic review to ensure that the plan is effective and updated as changes occur. Periodic on-site survey and review by certified CMS staff to ensure regulations are being followed. I do believe that no outpatient home care department is able to provide this comprehensive level of care. Additional thoughts. Why would CERCH not want oversight and regulation? Why doesn't CERCH honor commitments made to our community to keep valued programs and allow for community input before major decisions are made that affect us all for decades to come? We keep hearing about $1 million plus bonuses, new construction and acquisition of billing companies. Isn't our quality of life and healthcare choices just as important and worth fighting for? I hate to think that this recent decision is
Thank you,
driven
ma'am.
by money. What
In
about?
fairness to everybody, I'm going to have you stop. Thank you.
Thank you.
I want to take up too much of my time and explain that I'm not related to Kevin Mosher. Hi, I'm Elizabeth Mosher. A lot of people call me Bitsy. I'm a retired nurse practitioner, RN, been in Sitka 46 years and worked both sides of the fault line multiple times. So I've written a couple of letters to the editor, but I'd like to just read a little bit from this. Regulation certification serves a purpose, and my big concern is the Medicare certification piece of this transaction. And so I'm looking for clarification of information. Patients, families, as well as Medicare and other insurance groups can have specific expectations about care and services provided by an agency that maintains that Medicare certification. If you don't have that certification and you're coming up with a program yourself, you can change it at any time or make adjustments, and people around getting the services don't necessarily know what to expect. The goal is to maintain a baseline standard of care. And when I look up and see what are the Medicare regulations for home health, I can know what I'm going to be getting. And as far as billing goes, Medicare, when they reimburse, or Aetna or TRICARE or other insurance agencies out there, know what they're going to get if they have a Medicare certified program, what they're paying for. So I called Medicare, I called SHIP, which is a Medicare advising group, and they told me that they do not pay for home visits that are not through a Medicare certified program. So that was the information that I got and I'm operating on. And the other thing is I called my Aetna group insurance and said, well, if Medicare doesn't pay, would you pay for home care services rendered to me with your insurance? And they said, we follow Medicare. We would require Medicare certification. So that's the piece that I'm concerned about. That piece of Medicare certification, will my insurance, two of them, cover? Now, the point is brought up about sliding scale. Don't offer me a sliding scale to pay for services I get when I have two insurances that aren't going to cover because it's not certified. So that's a concern that I have. Lastly, an effective home health care program really is driven by specialized professional nursing staff who are responsible for case management and coordinating of services and meeting a whole lot of needs that have already been outlined. And one RN heading your department and carrying the load is not effective in my book. So if you're going to treat your staff respectfully, I would have expected a little more respect to your RN staff. Thank you for your time. I appreciate it. And I hope to keep this dialogue open so that we can serve everybody. Thank you.
Hello, I'm Cindy Littman, and thank you for this opportunity. I do want to preface this by saying that I was very much in favor of the merger between the hospitals when it happened. And so I do not fit in with Dr. Brule's assessment of the source of the anger about the closure of home health. My husband received home health through Sitka Community for 2 years before he passed away. And I've written already and spoken already about the benefits of that services and those services. And I want to talk about something else right now. I think the thing that people need to pay attention to is the idea of Medicare certified home health. That was fuzzy in the discussion today because certification can come from different organizations. Medicare provides healthcare for elderly Americans and people with other kinds of disabilities. It's a federal entitlement program, which means it is a right granted to citizens and certain non-citizens by federal law. All Americans must participate in the Medicare program through payroll taxes defined by federal law. In fact, the average wage American worker pays $61,000 in their lifetime in a contribution to Medicare. Medicare certified home health is provided free of charge to Medicare recipients who meet home health requirements. It's paid by Medicare Part A in that situation, which is the hospitalization portion, because it is so successful in keeping people out of hospital. It's very cost effective. Since Search abandoned the Medicare certified home health, their home health services to Medicare recipients are no longer covered at 100%. Dr. Brule talked about a 20% copay, but that is not trivial because if you're having several therapies or visits a week at a few $100s per visit, that 20% becomes several $100s a month. And that may be fine if you're a physician or a hospital administrator, but for an average retired person over 2 years' time, that would have cost us out of pocket thousands and thousands and thousands of dollars. And furthermore, the closure of home health, of Medicare home health, has required seniors to essentially be paying double, once through their Medicare taxes during their lifetime, and again for a significant copayment for health services that are an entitlement for all Americans over 65. And again, I wanted to, and then talk, well, I'm running out of time, so I will not move on to another subject. But thank you very much for initiating this inquiry, and I hope that there's a good resolution. Thank you. Search pen.
Hi, my name is Oriella Hughes. Very happy to be here at this moment. And I'm just looking because some people I don't really even know on the assembly. So it's nice to look at you and say hello. I was one of the founders of Braveheart Volunteers. There were 3 founders: myself, Father Dave Elsenson, and Jean Frank.
Please continue. It's an internal thing.
Okay. And I say that because I noticed earlier, Dr. Brule had mentioned that he was a founder of Braveheart, and there's only 3 founders, and you can check that. That's part of public record. The main thing I wanted to say is that without home health, the way that we have had it, which means not just one nurse, That means multiple nurses doing case management. It is very, very, very difficult to do any kind of home death. I'm not going to call it hospice because that's a term that's used in a certified manner. So we do we do home death here, we do end of life care, we do palliative care. Without home health providing 24/7 nursing, you cannot do it. You can have all the Braveheart volunteers you want, all the family members you want. You need the medical professionals in there because you don't know what's going to happen at the end of life. And things happen. Very difficult things happen. So you need nurses that can come in and cover for each other. You need nurses that can come in the middle of the night if something goes awry. And you need doctors that are involved also. So this is my concern because I think, personally, I think it should be everyone's right to be able to die at home if they want. They should not have to go to a skilled nursing facility. They should not have to die in the hospital if they want to die at home. We cannot do that in this community if we do not have the staff to do it. So this is my concern. And we know Dr. Brule has mentioned, yes, search is a business. And it's not profitable to have a certified home health agency. It doesn't mean that it's not the right thing. It is the right thing. It's just not profitable. You do it because it's a service. You talked a lot about services. That is the service we need. Thank you very much.
Well, good evening. My name is Richard Wien. So much to say, so little time. I took a lot of notes and it would take a lot more time to do it. When Assemblywoman Carlson had asked her question, what would you do differently? I actually expected a different answer. And one of the answers that shot through my mind was, I would have come out to the public sooner and would have explained and would have had, in essence, a town hall kind of interaction, which would allow people to ask questions actually directly. And I think one of the failings of tonight was not opening the floor to the few very articulate individuals who came here with highly specific questions. And I think that all of them deserve an answer and not to have any form of speculation. I feel we are in a small community, and I agree that I've seen a lot of money being thrown around by the organization of Search. And to me, home health care, it's nice to make money, but sometimes you need a lost leader. Every business knows that you have some little item that you get somebody in, and once they're in there, I'll say maybe buy other things. But the important thing here is that this is something that maybe Search would have benefited by greatly, especially to do the healing, if they allowed a little money loss, but allowed a greater service for our community. The other thing is I used to sit on the Sitka Community Health Council. I did resign because I was uncertain as to its value. But the important thing is, he said it's been meeting for like 3.5 years. And I personally do not recall hearing, and because there are Sitka Assembly and city people who sit on it, I do not recall a single report. And so if this says at least one thing, is please report on these meetings that are going on, that are apparently part of the process that is so important, and that's why there's no interaction. So there's a lot to say here, but one thing is, I feel very guilty. I feel guilty that I am here in Sitka, enjoying all this incredibly wonderful weather of rain and wind, and all the tourists are are not here enjoying it with me. So I just hope that maybe the cruise lines will start having storm cruises and get to enjoy 35-foot seas and docking during wind and stuff like that. Just an idea, but I do like home health. Thank you.
Good evening. As you see, I got the memo apparently regarding the holiday wear. My name is Annette Evans, and thank you, Mr. Mayor and Assembly members, for the opportunity to speak this evening. I am a Sitka Community Land Trust homeowner, the newest homeowner there, and now a board member for the Sitka Community Land Trust. I'm here to give you a little update of what the Land Trust has been up to this year. 2023 was a big year for the Sitka Community Land Trust and our Susini Shack community on Halibut Point Road. I'd like to share a few highlights. Last month, we completed the first home on the second half of the land you donated to us. This is the house our board president told you was breaking ground last April when he spoke to you with the last update. This is the second home we completed this year and officially brings the Susini Shack community to its halfway point with 7 completed homes of the 14 in the neighborhood. We really appreciate all who come to our open houses and those who continuously support our mission of creating lasting, affordable home ownership opportunities for people of low and moderate income in Sitka. I personally can attest that without the Sitka Community Land Trust, I would not be a homeowner in Sitka today. And I don't know if the opportunity would arise in some other fashion. We have had several local groups contribute to our Homebuyer Financial Assistance Fund this year. A big thank you to the Sitka Rotary and Sitka Legacy Foundation for their recent grants. There is one remaining house lot on the Phase 1 land, and we intend to start construction next month. This will be a 1-story, 2-bedroom, 1-bath, 825 square foot home with a big front deck. We are still seeking additional subsidies from state and federal avenues to keep our home ownership prices below $300,000. This is looking really difficult for our next house scheduled to start construction in March 2024. On a brighter note, we are pleased to announce we have been awarded a grant from the Rasmussen Foundation to start the design and planning for the Susini Shack community apartments. The Rasmussen Foundation has supported our mission for over 10 years, and along with the City of Sitka, are our largest partners. We hope to break ground on the community apartments in March 2025. If you don't know more about those, please reach out to the Sitka Community Land Trust. We'd be happy to share more information with you on that. Thanks to the Greater Sitka Chamber of Commerce for focusing on housing issues in their fall lecture series. It's been inspiring to live in a community that comes together to learn and address the complex issues that impact us. The Community Land Trust model of permanent
Thank you. And in
affordable
fairness
home
to everybody,
ownership
we'll have to have you stop at that point.
meets our housing
Thank you very
needs.
much. I appreciate your time
Thank you,
this evening.
Stephen.
Thank you.
Good evening. My name is Austin Cranford. I just wanted to mention briefly search, as with other members of the public. They mentioned that they are a business and they are required to cut cost as any business is required to. I would like to remind people that they are actually a nonprofit organization that receives funding from the Bureau of Indian Affairs and other federal agencies. So the fact that they're cutting services for cost-cutting measures is a little absurd, especially considering they've failed to uphold other legal requirements. I know myself, my father, and other veterans continue to go up to Anchorage because search cannot seem to follow federal and state regulations. So I would definitely inquire as to why they want home health to no longer be regulated. Is it because they're incapable of following the regulations or because it will benefit the community? Thank you.
Anyone else this evening for persons to be heard? Seeing none, that'll bring us to consent agenda.
I move to approve the consent agenda consisting of item A, approve the minutes of the November 28th Assembly meeting. Item B, approve the following standard marijuana cultivation facility license renewals. Number one, Jeremy J. Erickson, DBA Vern's Wicked Weed at 3872 Held Point Road, Bay 1. And number two, Van Greens LLC at 224 Smith Street, units B, C, D, and E.
Second.
It's been moved and seconded to approve the consent agenda. Is there any public comment?
Good evening. My name is Richard Ween, and I'd like to speak to item B. These are legal businesses, and I certainly have no objection to people having these licenses granted. There was a referendum put to the city about marijuana sales because the governor let it be that individual municipalities and cities could determine their own rules, and the city voted 70% to 30% to have the sale of marijuana within Sitka. I proudly say I was part of the 30%. The important thing here is that what Serge mentioned today, mental illness, behavioral health increased 2 times, opioid clinic needs increased 2 times, and all the drug and mental health areas have increased. And you have to understand, at least in the literature that I read, meaning the medical literature, that mental health issues have just exploded, especially in the pediatric age group with marijuana access. And this is the other aspect, because Sitka has become number 1. Ichiban, which means number 1 in Japanese, that that increases access, firstly, to children. And I believe that these things do, what can I say, promote mental health issues throughout and up and down our Sitka spectrum. And of a funny thing is that the cruise line industry is currently kicking off individuals who are found with marijuana products and also hemp products, CBD, from the cruise ships. And so there were a couple of very high profile cases where people were thrown off and it hit the news, but the cruise lines are not wanting it because it's still federally illegal. But somebody who has a clever mind in the newspaper organization say they don't want weed on board because they want to promote their liquor sales. But I don't know whether that's true or not, but the mental health aspect is very real. And the city and meaning our assembly need to really consider what they do with all of this availability coming around. So enjoy, relax, have a doobie, think about it. Thank you.
Is there any other public comment on consent agenda? Sarah?
All right, on the motion to approve the consent agenda consisting of items A and B, Mayor Eisenbais,
Yes.
Mr. Pike,
Yes.
Mr. Yestad,
Yes.
Mr. Mosier,
Yes.
Mr. Celine,
Yes.
and Ms. Carlson.
Yes.
The motion passes 6-0.
Thank you. That'll bring us to item C tonight.
Mr. Mayor, if we wanted to separate one out, would we make the motion first for all of them, or we were first, or we do that now?
I believe the proper way would to be divide the question once the question has been asked. So we can make the motion and then separate out a candidate by dividing the question.
Okay.
Your motion could also only include the names in which you wish to consider, and then we could consider the other name or names.
I'll do that. I move to appoint Dr. Paul Bana to an unexpired term on the Health Needs and Human Services Commission and Crystal Duncan to an unexpired term on the Health Needs and Human Services Commission.
Second.
It's been moved and seconded to appoint Dr. Paul Bana and Crystal Duncan to commissions. Is there any public comment?
Good evening. My name is Richard Ween, and I will always get up to thank those individuals who will perform community service. I've known Paul Bana for many years. He's a gentleman and a scholar, and I believe he will be an incredible asset to the Health Needs and Human Services Commission. And I do believe that he has been on there before. And again, thank you to Crystal Duncan, who continues to serve the community on this very interesting committee. So again, thank you very much for stepping up. And I just hope that it is everything that you imagine. Thank you.
Is there any other public comment on the motion? Back to the assembly for deliberation. Sarah, on the motion?
All right, on the motion to appoint Dr. Bana to an unexpired term on the Health Needs and Human Services Commission and Crystal Duncan to an unexpired term on the Health Needs and Human Services Commission. Mr. Yestad?
Yes.
Mr. Celine?
Yes.
Mr. Pike?
Yes.
Ms. Carlson?
Yes.
Mr. Mosier?
Yes.
And Mayor Eisenbeis?
Yes.
The motion passes 6-0.
That'll bring us to the last item or the last name on committee appointments. Without a motion, we will be moving forward on tonight's agenda. As no motion has been made to appoint that individual to the investment committee, we will be moving on to unfinished business tonight. Item D, please.
I move to approve ordinance 2023-24 on second and final reading, making supplemental appropriations for fiscal year 2024.
Second.
That's been moved and seconded to approve ordinance 23-24. Is there any public comment?
Good evening. This is Richard Ween. This is an appropriation for the second reading. And so what happens tonight, which it will pass, I'm sure, will grant the additional monies to the appropriation. The original appropriation was $285,000, and now it's going to be up to $354,000 plus a 25% contingency. There was a discussion held at the last meeting, and I hope people were paying attention then. So now it's $442,000. As you note, that the city has to maintain these items in perpetuity, and there will be separate maintenance agreements between the DOT and the Park Service, something anyway. My handwriting here. But one of the important thing is that the city will have to pay any additional cost overruns because the granting has kind of like topped out. So, you know, these are things that citizens really need to know and to be aware of. And on the Friday, December 8th, issue of our beloved Sitka Sentinel, there were all kinds of other little things about the walkways and land trust protests, park service actions, and, there might be lawsuits and so forth. So things become complicated, even though this thing seems to have been planned out for years. So do your best, and an informed citizen is something that is good. Thank you.
Is there any other public comment on ordinance 23-24? Back to the assembly for deliberation. JJ?
I'd like to take a moment to thank Ron and the rest of the Public Works Department for preparing that presentation, coordinating that, and getting those questions I had answered. I really appreciate that. Thank you.
And Kevin?
Yeah, I was wondering if we could call Ron up real quick.
Good evening. My name is Ron Vinson. I'm the Public Works Director for the city.
Hey, Ron. Thank you for coming up. Thank you for all your work on this. After the last meeting, I went in and we had an appointment and we briefly chatted about this, and I expressed my concerns about, I think this is a worthwhile project, but now that the grant funding is kind of pittered away, and we kind of discussed that so the public can kind of hear. As this moves forward, do you feel that, we have control over, so we're not going to get into this and then have to keep funding this over and over again to a large degree? We're going to have some measure of control. Can you speak to that?
Right. I mean, just like any other project, especially with the volatility with, supply chain and all that fun right now, there's always a chance of cost increase. When that happens, we're closely monitoring our budget, doing our due diligence. The project management team, I think, has a good grasp on this. If there's any indication of that, we'll know long ahead. So I feel comfortable. I don't think that this specific project poses any extra risk than any other project we have going over.
Okay. Thank you.
You're welcome. Any other questions for Ron while we have him in front of us? Tim?
I do have a question about the ongoing maintenance. So I believe that question came up last time. Is that covered also by the same funding sources as the one that we're looking to tap for our portion of this grant or this project?
So in part, I know right now for the existing portion of the seawalk that we cover, there are janitorial services to do trash cleanup, things like that. I don't anticipate, or I wouldn't imagine that we would charge things like snow removal. It's not necessarily tourist season. We want to be very strict about that kind of thing. So.
Okay, and any overruns would also come from the same funding source, or would that be on the general fund?
Any overruns for maintenance?
No, I'm sorry, I have to go back to the original. So since we're responsible for any overruns to the project costs, would those also come from the same funding source, or would that be from the general fund?
That's a good question. Yeah, that's a good question. I think that we would probably go after CPV first, and then if it didn't work, there's probably opportunities for grants and then general fund, I would imagine.
Can I ask that question to Melissa?
It will essentially be up to the assembly to decide where any of those cost overruns come from, because we are funding such a small portion of this project with CPV funds. I think there is room to justify if there were an overage pulling it from CPV, because this this portion of the Seawalk is really going to benefit the cruise passengers.
Any questions for Ron or Melissa while they're up here? Thank you both for your clarifications on this. We appreciate it.
Thank you.
Further comments, Tim?
Thank you. Yeah, I think, we've talked about this a bit, and I think this is one of those projects that, I think we are in control of how it goes along. And if we're seeing this thing is getting out of hand, I think we have the opportunity to pull back a little bit. So or pull back at least a portion of it, or decide just not to do it. So as we go through this process, I think as Mr. Vincent pointed out, we'll have a pretty good idea what's possible and what this is going to looks like, especially when the bidding happens. We can decide at that point whether or not we like it. So.
I guess for me, I'm just excited to be able to walk around the outside of the O'Connell Bridge. You know, we as residents get the full benefit of the Sea Walk right now, in not only during season, but in the off season as well, where I see strollers constantly up and down the Crescent Harbor part of it. So I'm excited to see strollers and puppy dogs running around on the outside and, you know, sitting on the benches. I was reassured to see that there will be lighting on the outside of that area as well. I think it'd be pretty dark and dangerous on a day like today. So that was good for me. I'm excited to see this one go forward. Sarah, on the motion?
All right, on the motion to approve ordinance 2023-24 on second and final reading, Mr. Yestad,
Yes.
Mayor Eisenbais,
Yes.
Ms. Carlson,
Yes.
Mr. Celine,
Yes.
Mr. Pike,
Yes.
and Mr. Mosher.
Yes.
Motion passes 6-0 on item D.
That brings us to item E tonight, which is a continued discussion direction decision on the acceptance or rejection of the state of Alaska's lease for an airport. At our previous meeting, we did move to postpone this item till today to allow for additional time for review and the lease document. John, do you have anything further that may enlighten the assembly since the last time we met?
Yeah, thank you, Mayor. I actually have not heard much back from the community on this. I think their points have been made over the past few months, and I think we've discussed the concerns here at the table quite often, and we've had some good discussions with DOT, and they also showed up and made a public presentation. But I think the expectation is out there now with some help from our local media too, and kind of outlining what this new lease looks like. And as I said in the last meeting too, our airport's going to look different. So I will say one change, well, a couple things since the last meeting. I had originally believed that an ordinance would have to go with this lease, meaning this needs to be the final clean copy, and we need to have a 2 reading ordinance. We've later learned that an ordinance is not required because we're not selling any city property there, and that's a code section that explains that. But entering into this long-term lease is allowable just by action here at the table. So I think, and I hope there's some still some flexibility. I hope tonight I get some guidance from the assembly to give me the thumbs up or thumbs down on moving forward, and I'd still like to come back with a final clean copy. One small thing has changed because I couldn't let it go. I had to ask the question about the concessions. We keep hearing that the concessions are required. The 5% on lodging services, 6% on food and non-alcoholic beverages, the 8% on sales of goods and merchandise, and 12% on sales of alcoholic beverages. Those are, it is very true, they are required concessions by the FAA, but they have very strict rules on revenue diversion. So I made my case that if we are going to collect those concessions, I had some fear that if we were to then remit those concessions to the state, that they might end up at the airport, but not necessarily our terminal. So I had asked, if we're going to collect them, can we, I'm going to try again, can we keep them? Because that way I can ensure that they are going to go back into our terminal under the FAA requirements. So it looks like we're going to move ahead on that one. The state did check with the FAA. We got the thumbs up from the FAA on that. However, we will still need to follow the same reporting and audit requirements as if we were still remitting the funds to the state. So we didn't really reduce any of the administrative burden. If anything, we probably brought a little more risk back on ourselves, but the revenue comes with it now. And the risk is that we're going to monitor and make sure it's spent back at our terminal in accordance with the FAA regulations. So if we move forward with this tonight, even just the direction to move forward with the lease under these terms, I would expect to come back to the table with a clean copy and a potential change in the language around the collection of concessions. Thanks.
Assembly discussion. Kevin?
Thank you, Mr. Mayor. I'm going to support this. We've heard a little I'm glad that we took the time to allow the public to look this over and comment on it. We've gotten some input, but not a lot. Not a lot's changed. And I think this is the best we can get. And we're looking at getting a very nice airport and a improvement that's been desperately needed for quite some time. The majority of that not paid by us, which is going to be really nice. Thank you for everyone who's worked on this to make this happen. And I guess that's it.
Tim?
Thank you, Mr. Mayor. Yeah, I think, direction for John is, yes, let's keep moving forward with this thing. I think, careful listeners from our past meeting, I think should have walked away with the understanding that maintaining control of our airport is in our best interest. We want to be presenting, the experience and the opportunities for our people, for everyone who lives here, and the visitors. We want to make sure that we control more of what that looks like. So I'm in favor of that part of that's. I guess that's kind of why. And I'm not surprised that we didn't hear a lot from people. I read the 55 pages. I don't know. It was quite a few pages of that, very dry stuff. But it was very interesting to see kind of what we're committing ourselves to over long term, and I'm comfortable with that. And I think it's important for us to do that, and to, while I disagree with the state's negotiating techniques and perhaps where they're headed with stuff, and trying to shift responsibilities to the communities and not really considering that one size doesn't fit all, I think this is the best we're going to do at the moment, and I encourage us to move forward.
JJ.
I also encourage us to move forward and want Sitka to know that, that parking conversation will still pop up in the future. It looks like we can pay for the increased needs of expenses through these sublease negotiations first, but parking will become a thing, and not now, but eventually we're gonna probably in my 3 years need to get back to it. So I'll be having that conversation with you then.
Chris, just wanted to make sure you didn't have anything. I can't see you online right now, so.
Yeah, no, I could pretty much echo a lot of what Tim had to say there. Wasn't overall happy with the negotiation with the state. I had a lot of heartburn over some of the uncertainty of, could we afford this, and it being a 55-year term, kind of locking into that. John tried his hardest for negotiating better terms. And I was really hoping that maybe that shorter term would stick, but again, that wasn't accepted. But, this concessions change helps ease my heartburn a little bit. It's a little bit more money to help us pay for the added expense that we're going to see. So, I think we need to move forward. And I still have some reservations, but in general, I think this is the best we're going to get, and just move on with it.
John, thank you for continuing to push on concessions. I'm glad that those will stay within our operating fund for maintenance and operations of the building, as opposed to being spread to who knows where. There's a lot of additional fees with this, most definitely, and I'm glad to know that that'll somewhat offset it, even though a large majority of it will be coming out of our pockets when we dine at the Nugget on either a Sunday or our way out of town. So also, Kevin had talked about the public comment that he had received on this, and I've received a bit as well in the meantime from the last meeting. And I think the overall message that I received is, the public at this point understands that in order to have a modern airport, we have to have a modern fee structure as well. And I don't think anybody was necessarily in favor of keeping the airport that we have now and keeping the status quo. I know people weren't necessarily in favor of a new fee structure, but I think there was the understanding of the modern airport comes with a modern fee structure. So with that, I will vote to move forward on this when we do have a motion, and hope for the best in the lease. John, continue to work on it. And Chris, I think a longer term may benefit us on this one, because if we would have had a 55-year term last time, we wouldn't have been renegotiating right now. And I think regulations will only get stricter as time goes forward. So maybe a long term, crossing my fingers helps us in this instance. So. If nothing else, if the assembly decides that a motion is in order.
I move to direct the municipal administrator to accept the State of Alaska's lease for the Sitka Airport and bring back the final document for assembly approval.
Second.
It's been moved and seconded. Is there any public comment?
Good evening. My name is Richard Ween. This airport lease is actually a pretty big deal, and it is a big deal for any number of reasons. But one thing I cannot accept is that when our dear administrator said that he had not heard much back from the community. And if you will just recall that, what was his name, Troy, who gave the Seawalk 2 talk, he said that when they had the comment thing, there were only, for this whole thing, only 28 comments. So to me, one thing I've noted, there is a certain disconnection within the community. And so I think that the administrator needed to be proactive, and I'll say sell it, give us his reasons why what are the pros? Why is it good for Sitka? Why is it good for the citizens? And outline all the major issues. And to me, it's just not good enough to say, well, I didn't hear nothing. And I feel that that certainly can be improved. And I noted that 2 weeks have gone by, and the delay was so we can get more information. I didn't realize you meant that the citizens had to go out and do their own digging. We again noticed the disconnection. So I think it was imperative on the city and the assembly to give out that information on why they are voting, and not just saying, hey, it's a good idea, and be chipper about it, but to give that delay some food for thought. You have to understand that there are going to be, and this is just general list, there are going to be concession costs. And even though they go back to the airport now, the question is, hopefully, as was mentioned in the memo, these individuals may not be able to afford it. So, I love the Nugget, and I hope it sticks around. What is it? Airport 29. We'll see what will happen with them. At the Nugget, it's easy to go through 50,000. The leases, there will be additional FTEs. There will be possibility of a head tax. There's a 55-year lease. There's going to be the need for airport security. I'm sorry, move along. Move that fish box. There will be, I don't know whether they had a legal evaluation was obtained. The lessee is responsible for all utilities. The lessee is responsible for hazardous waste. The lessee assumes financial responsibility for any contamination, etc.
Is there any other public comment on the motion? Any further assembly deliberation? Sarah?
All right, on the motion to direct the municipal administrator to accept the State of Alaska's lease for the Sitka Airport and bring back the final document for assembly approval, Ms. Carlson?
Yes.
Mr. Yestad?
Yes.
Mr. Celine?
Yes.
Mr. Mosier?
Yes.
Mayor Eisenbeis?
Yes.
And Mr. Pike?
Yes.
Motion passes 6-0.
Thank you. Before we hit new business, it has been an hour. We'll take a recess and please be seated when you're ready to continue assembly. Chris, were you able to make it back on?
I'm here.
Awesome, thank you. The assembly is seated, so we will continue with our agenda this evening. Item F, please.
I move to approve ordinance 2023-25 on first reading, making supplemental appropriations for fiscal year 2024, CLIA Pacific Northwest Cruise Symposium.
Second.
John, do you have an introduction for this item?
Yeah, thank you, Mayor. I'll be quick. Every year we attend Sea Trade Cruise Global, either in Miami or Fort Lauderdale. And over the past few years, it's been to sell and promote tourism in Sitka. As we've talked about before, the past few years have been manage and control tourism in Sitka. And we've had the opportunity with a lot of, I'd say, aggressive scheduling to sit down and talk to business leaders from all the individual lines and leaders from CLIA and come back with some great information. But we've realized through that it's Sea Trade Cruise Global, and there's people from all over the world there. It's a pretty big event, and it's hard to get that individual time, especially when we want to talk about regional things. So CLIA brought up the idea and had been mentioned this before about starting a Pacific Northwest Symposium, where it's focused on cruising in Alaska, Southeast Alaska, Vancouver, Seattle area. And I think we'd get more individualized attention there. However, this is the first year of this event happening. And I don't know how well organized it is. Ideally, I want to stop going to Sea Trade Cruise Global and start focusing on this instead. It's a lot less traveling across the country and much lower costs if we're only going to Seattle. But with that unknown of what this looks like yet, we're bringing this ahead forward as a supplemental appropriation so we can do this in this late January, early February. And if it's a worthwhile event, I think this is where we would more focus our efforts in the future.
Thank you. Is there any public comment on the ordinance?
Good evening. My name is Richard Ween. I hope you all have a good time when you go there. $5,000 is a little bit of pocket money. The important thing here that I see is that, firstly, Sitka is a pheromone. It is definitely a deer in rut. I mean, people are attracted to us and they will come to us because they need us, okay? And going down to these things doesn't make sense, especially where we are now. We need to be in the notion of management and not promotion. And I actually think it would be wonderful if those big wigs, if they really want to come to Sitka, would come here, would fly up here, and maybe have a town hall so we can meet the president of Princess and Royal Carib and all these other places. And I would be quite excited for that. But the thing that I see within the memo is that this is a significant gathering to advocate for regional and responsible tourism in Sitka. But what's really funny is I don't know what the assembly really thinks. There's no white paper. There's not even a 250-word essay on what I think is responsible tourism in Sitka. So we have the tourism task force, but here you're going to go down and it says here to persist in advocating responsible tourism in Sitka. That's the second time it mentions it in a page and in a quarter. And the important thing here is I would like to have a white paper before you guys go down on what you consider to be responsible tourism in Sitka. I have no clue. I would have a clue if perhaps you'd send Larry Edwards. I know exactly what he thinks is responsible tourism, but I don't know what the elected officials think about that. And they even mention it again, the proactive steps aligns with our commitment to fostering responsible tourism and positions Sitka strategically within the regional dialogue. Like I said, we're a deer in rut. The bucks want us. And let me tell you something, we don't have to go down there. They can come to us. And I think that would be kind of fun. Actually, let them buy dinner, let them have a town hall, and let them answer questions directly from the citizens. They may educate us about all of this. Thank you.
Is there any other public comment on the motion? I'll bring it back to the assembly for deliberation. And I just want to add on to John's statement there that I do see this as well as replacing Sea Trade in due time. I don't know if anyone's been to conferences for their first time. Typically, they're not as good as the 30th and 40th time that they do them. So while I have no doubt that this conference is going to grow and will be the most bang for your buck that the municipality can get, I think this year visiting both fully covers ourselves. Happy to answer any questions about attendance as well that the members may have. I think I'll leave it at that. John and then Kevin.
I just want to add something very quickly. My hope is that as the task force kind of tells us where or makes a recommendation to the assembly on where they'd like to see tourism go, and I'm hearing a lot of support for a tourism manager in the future. And if that comes on board, that's where I see this going in the future, is if this task force sticks around as something more permanent, like a commission, and they have a staff member like a tourism manager, I will gladly step aside and have that tourism manager attend this event in the future if we go that way. But the reason for this year, as I mentioned earlier, is to learn and see what is going to build out of this event.
Kevin?
Thank you, Mr. Mayor. Yeah, I think this is, I like the idea. First of all, I am going to support it. I like the idea of having something more regional. And I understand that you're saying about eventually not going to Sea Trade. I'm not really opposed to going to Sea Trade and here and this year, but I don't know. I mean, do you guys still see value in going to Sea Trade?
I don't know who's going to attend this yet. That's the concern right now. If the lines that we need to speak to and some of the CLIA reps are not at this, but they're at Sea Trade, I lose an opportunity.
Okay.
Is the concern.
So
I would add to that this time as well, Congress is in session around the same time as Sea Trade. So we're going to be able to loop both trips into once, saving my a lot of seat time on an airplane. So with that, knowing that we could go to Sea Trade for just a couple days and then loop up to DC on the same airline ticket presents value to myself.
Okay. Yeah, I think this is warranted. Hopefully within the next year or so, we'll be able to fine tune this so that we aren't going to 2 conferences. I don't think long-term we would want to do that at all. And I don't think that that's your folks' intention. I just wanted to be clear. I think, say, next year, you'll have a better idea. And you know, you guys kind of took what I was going to say, the Tourism Task Force, which was created for the purpose of trying to help deal basically with tourism. Hopefully we'll have a little more information. They're doing a lot of hard work with town halls and very specific strategic questions. So hopefully we'll have a little more information for you guys to go when you to take with you when you go to this.
JJ?
Just a question here. It says this is for CLIA Cruise Line members. Does anyone know exactly what agencies those are?
There's hundreds, but the major lines that call Sitka are all members.
So this has a potential to have cruise lines that aren't currently servicing Southeast Alaska, BC, want to come to this conference, or will it only be existing cruise agencies, or is it too soon to know?
I would say it's too soon to know. We don't know who's going to go there, but I can reiterate that my goal in going there is to advocate for whatever we decide, whatever the task force decides, and the assembly decides is a responsible level of tourism here, because a regional strategy is what makes the most sense. What one community does can greatly impact another community, and when we're speaking together, especially with the Pacific Northwest as a whole, for example, if one community suddenly decides we don't want ships here, and they don't travel to Alaska, Victoria is going to have something to say about that as well. So being able to talk together and work through these things together is a big benefit. But again, I don't know who's going to attend yet.
I think that's a very important point, actually, is that this is going to bring Pacific Northwest ports together in the same room as well. So we can have a conversation on how the flow works and how does Sitka get to a point where Saturdays we don't have big boats. We may be able to have that conversation. To your original question, my understanding is, I don't know who will be there either, but my understanding, another large cruise line, MSC, is looking at the Southeast Alaska market. So could potentially be there as being a CLIA member, but we don't know that.
Okay, thank you. I think for two people to go to a conference specific for our needs right now is $5,000 well worth it.
Further assembly discussion?
Yeah, I'd like to add something, Stephen.
Yes, please.
Yeah, I definitely think this is extremely valuable. I see it in the future being way more valuable than sea trade. Being able to work with not just CLIA reps for the region, but also our regional communities is going to be invaluable. In fact, it's a part of one of the directives for the task force was to work with our Southeast communities, because anything that one of us does in how we manage tourism is going to affect the other. So this is going to be super important for responsible tourism. So I wholeheartedly support you guys going there and seeing how it goes. I hope it goes well its first year and will continue in the future, because this is going to be super important for cruising in Southeast in the future. So I definitely support it.
Anything further from the assembly? Sarah?
All right, on the motion to approve ordinance 2023-25 on first reading, Mr. Pike,
Yes.
Mr. Mosher,
Yes.
Mayor Eisenbais,
Yes.
Mr. Celine,
Yes.
Ms. Carlson,
Yes.
and Mr. Yestad.
Yes.
Motion passes on first reading, 6-0.
Item G, please.
I move to approve ordinance 2023-26 on first reading, making supplemental appropriations for fiscal year 2024 Greater Sitka Chamber of Commerce supplementary funding.
Second.
It's been moved and seconded. John, do you have an introduction on this?
Yep, very quick. Thank you, Mayor. As you remember, we approved the extension of the Chamber's contract. Their contract is off cycle from our fiscal year. So when we approved the option year of that contract, it goes from January 1st, 2024 to December 31st of 2024, but our fiscal year ends June 30th. Under our procurement policies in both code and charter, you cannot obligate funds that that are not appropriated. So this is basically encumbering the funds for the future year in current year funding, and then it will carry over on July 1st.
Is there any public comment on ordinance 23-26?
Good evening. My name is Richard Ween. This is for supplemental appropriation for extension of visitor services contract with the Greater Sitka Chamber of Commerce. And it's $150,000. I would like to suggest that if you look at the current structure of the Sitka Chamber and who's running it and so forth, and I don't mean Rachel Roy because we love her, but elements within the board and so forth, this has really been promoting and supporting the day cruisers on the big cruise ships. And if you notice, they get money for the color handouts and all this other stuff. And it really is all over here at Harrigan Centennial Hall for the day trippers, etc. So my suggestion here today is to get those individuals to show goodwill, to chip in for $150,000. And either pony that money up themselves because they have self-interest here, because that's what the Greater Chamber is doing, is promoting day trippers, or even better, take it out of the I guess it doesn't say where it's coming out of, but if it's not coming out of the CPV, it should be, because this is supporting the tourist industry, and that is definitely demonstrable. So I think there are other ways to fund this. It would be great to have the cruisers, put up a little money. And if not, the CPV should be paying it. It should definitely not be coming out of the general fund. And, if just another way, think about it. Thank you.
Is there any other public comment on 23-26? Assembly deliberation? Jessica, JJ?
Melissa, can you come forward? I have a quick question. From my memory, in last year's budget season, this is Visitor Enhancement Fund money?
Correct.
So that is the bed tax, the independent travelers?
Yes.
Okay, that lovely 6% that they pay. Okay, thank you. I think that is a valuable question, because the goal of the contract that we have, the primary contract, is for those independent travelers with Visit Sitka here. Question for you, John. What has been the last season's kind of contract look like? Is Visit Sitka kind of fulfilling their contract?
When we executed this option year, one of the requirements is it's called Attachment A, the scope of services, and they provide a report, and we basically audit what they report to us and make sure they're hitting all the items in that scope attachment. They were compliant with the requirements, which is why we executed this last option year.
So we're going into our last option year.
I'm sorry, I didn't mean last, as in like the last one. The last year I executed the option.
Okay. Maybe this isn't exactly the time to talk about it, because this is about the appropriation. But if we are potentially moving towards a position, this might not be an applicable service anymore for this full scope. Is that something that needs to get looked at as a discussion with the board of how does this contract continue if we're restructuring kind of our overall tourism management approach?
I can actually answer that question. I think I want to bring it back to just the cycle of that contract, because I think that's the important piece that applies to this appropriation here too, is if the assembly were looking to go a different route, timing is very important, because this coming spring, that's when you will have your work session with the chamber during the budget, and we'll talk about what things look like for the next year. And you essentially make a commitment in the budget before we've executed the contract, and then we execute an option. We almost execute an option year in advance, and then we kind of clean it up with the paperwork later. So I think if there is a desire to change that, is there 2 option years left, Melissa? Do you know? I think it's 2, but don't quote me on that. But if the assembly were looking to do something different, early this next calendar year would be the time to consider that. And if the task force says to do something different, hopefully that would come forward, because you would need time to let, if you're going to go the RFP route, get a new person, they can operate through the travel season, and then someone would be in place for the next one if the provider were to change. So I hope I summarized the timing well there.
Does that need to be a motion or another discussion direction item, or?
That'd have
how
to
does
be
that-
a separate item off of this one.
JJ, we can get to talk about this after the meeting. I'd be interested in that discussion.
Tim?
John, so what I read and what I think you've said, this is essentially an accounting thing. Is that correct?
That's correct.
Because this contract's already been agreed to. We're just figuring out the payment of it.
The contract has been agreed to, and the payment is actually there. It's just that it's not clean to obligate funds for a fiscal year that we haven't even done a budget for yet. So we're going to appropriate those funds in the current fiscal year.
And actually, I do remember this conversation when we agreed to this, because it was pointed out that their contract runs across 2 fiscal years. And so you were going to be back to do this very thing. So I recall that conversation. So it's not about what we like or don't like about this. This is all about accounting at this point in time.
The joys between calendar year and fiscal year. It'll be back here in front of us again at some point. Anything further from the assembly? Sarah?
Before I called for the vote, when the power went out, it reset the thermostat. So if you're freezing, yes, it's cold in here, but Simon has reset it to 70 degrees. So hopefully.
I was wondering about that.
Yeah. All right. So now the motion before you is to approve ordinance 2023-26 on first reading. Ms. Carlson.
Yes.
Mayor Eisenbeis.
Yes.
Mr. Celine.
Yes.
Mr. Yestad.
Yes.
Mr. Pike.
Yes.
And Mr. Mosier.
Yes.
So the motion passes 6-0 on first reading.
I guess this is where the agenda change for jumping jacks comes into place to get us warmed up. So tonight we have one additional new business item, appointing an assembly member to the City and Borough of Sitka Strategic Plan Team. John, once again, you are a popular man. If you could introduce us for this one, and we'll have an assembly discussion.
I'm actually going to ask if Melissa Henshaw could come up. She's been working with the strategic plan contract or consultant.
Melissa Henshaw, Public and Government Relations Director. So this extra time commitment as an assembly project team member for the strategic plan update is just an extra 2 hours of your time. And it will be held on December 18th from 1 to 3 p.m. So I guess I would ask that whomever is appointed, that they be able to attend that meeting. Otherwise, all assembly members will be interviewed in the next few weeks, and there is that all-day workshop on January 20th.
Thank you, Melissa, for that one. It pretty much clarifies my unavailability for this one. December 18th during the noon hour is a rather busy time for me, so hopefully another assembly member has more availability.
I'll do it.
Anybody else interested?
Unless anyone's opposed, Scott has the time and ability to be our representative to the strategic plan team. Thanks, Scott. Appreciate that. Most definitely a bad time for myself. Okay, we will move on to persons to be heard. This is public participation for any item on or off tonight's agenda, not to exceed 3 minutes.
Good evening. My name is Richard Ween, and believe it or not, this is the last assembly meeting before Christmas. So I would like to wish all of the assembly members and our administrator a very Merry Christmas. The next meeting is on December 26th, which I can't wait for, as I'm sure you know, and it's Kwanzaa. So I'll be able to wish everybody a happy Kwanzaa on that day. One of the, so much again to talk about, but I did attend the Tourist Task Force town hall, and I found it very interesting in that one, there's a concept of conformity bias, which in the open way that they were presenting it in the votes, I think that that is something that can come into play. And I invite people to go to even YouTube or go find his paper. Solomon Asch had his famous experiment about conformity bias, which is just extraordinary on how people are influenced by the person next to them. And so that was kind of interesting, but they gave some new things, and part of it is new business registration. They said that this is so important because there are so many more new businesses since this occurred. So in 2021, there were 158 business licenses. In 2022, there were 188, meaning in that 1 year, there were more than 30 that were added. And in 2023, there were 207, or 19 additional businesses. One of the interesting things is that they passed out this flyer here, and bottom line is it said that they couldn't really figure out whether any of these were related to tourism, because they didn't have the ability to understand what the new businesses were and what they actually did. To me, that is a sin of omission, because the city has a way to require, you know, what you're going to do. They could code these things about what's going to happen to your business. And if you go to the state, you can see that they at least have to have a statement about what the heck they're going to do. There are two members sitting up here tonight, one who has a new business from 2023, and the other one from 2022. So those are included. And the question is, they made the deal that this is going to be jobs for young Sitkans. And my question is, show me, granulate the information, teach me.
Good evening. My name is Austin Cranford. Previously, the past 4 assembly meetings, I've brought up the same topic. I'm bringing up the topic of drugs in schools again because about a week after the last assembly meeting, we had a drug overdose in the Sitka High School. I don't know if it's inaction, incompetence, corruption, but the assembly has the authority to do investigations under section 2.12 of the charter. Why are drugs in schools? Why do we have kids overdosing in schools? And why is nothing being done about it? I request that the assembly, under the public participation general code, direct the city administrator to launch an investigation by the end of the month, or by January. I will be using section 602 of the charter to initiate recalls against all elected officials that have not been recently elected. Thank you.
Anyone else for persons to be heard this evening? Seeing none, that will bring us on to reports. A lengthy report this evening that I'll try and make as efficient as possible for the assembly. Myself and the administrator just got back from AML, probably the most worthwhile AML that I've ever been to for multiple reasons. But we'll start with, I think, one of the most important, and that is our city administrator, John Leach, has won the Emerging Municipal Leader Award from AML was nominated by Sitka, and as AML's wording is, the Emerging Municipal Leader Award recognizes an emerging municipal leader, their early career contributions to local government, and their potential for future success in local government. So now that John has won this, he has to back up his early career contributions with future successes. So now he's on the hook for some time for that. So we were pretty honored to have John win that award. I think he was rather surprised by it. I'm so surprised he didn't even have a speech prepared, but was able to come up with something. So congratulations on that one, John. As I had indicated earlier, this is probably the best AML that I've been to in quite some time. AML continues to grow as an organization. When I first started going, there was 2 employees of AML, and now they're up to, it's either 26 or 28 employees. And all those employees are dedicated to providing services to its member municipalities, such as sales tax remittance, grant accountants, and such. So the organization has grown, and it's definitely become a powerhouse within the state in order to help communities such as Sitka and communities smaller than Sitka. Let's see. I did attend multiple sessions throughout the last few days there. As is normal, all of the members that were attending tried to split up into the concurrent sessions so that we could get the most value out of all of this. I know I attended some of them. JJ was able to attend some of them, and then Scott as well, attending some different ones that either interest us or that we needed to learn more on. One that I found to be extremely interesting, and I'll bring back some more information to the assembly, is that through AML, we're actually a member of the National League of Cities, which has a lot of online training ability that I was unaware of, and a lot of online information that we can use. So I'm going to be going through that process in unlocking those portals for us, and then getting that information out to the assembly so that we can continue to use some of the National League of Cities information in order to strengthen not only our position, but then our town as well. So besides AML, and I'm sure John will fill in anything that I didn't, and then if JJ and Scott have stuff about newly elected and the rest of the conference would appreciate that. Oh, there is. Can't believe I almost forgot that one. After years of ducking and dodging it, I was elected to the Alaska Municipal League Board in the seat of city and borough. That does require my attendance at the upcoming conferences, which we already have in the budget. But if anyone on the assembly has any concerns or issues with my participation on the board, please either bring it up with myself or with the municipal clerk, and we can go through that process. With that, I'll pass it off to John.
Thank you, Mayor. Again, my report is mainly focused on what we did last week at AML. The first 2 days of that session was the Alaska Municipal Management Association. Remember, it's management or manager. I think it's Management Association, where city managers from throughout the state get together. I was elected the vice president of the board of that organization, so I will also have some time commitments, and in a year I'll have to be the president of that board as well, which means I'll be doing some conference planning. But it was an honor to be selected to do that. Some great training sessions that we had. One that was very interesting was we talked about AI in local governments, and we talked about what other states are doing, what some local governments are doing, and they really outlined the risks of stringent rules around AI and the risks around having no rules around AI, because it can be a useful tool if you know how to use it. And there's a lot of, there's grad school level classes now on how to use artificial intelligence in your work. And they equated it to, remember when Microsoft Word came out with autocorrect, and I remember my teachers when I was in school, like, you can't turn that on, where we're testing you in your English class. So and now it's the norm. So talked a lot about that. But as far as the sessions go, when we came back together as the all the local municipal leaders, both the assemblies and councils and managers. I like that we're able to divide and conquer and go to some of these concurrent sessions. I personally attended the introduction to asset management. It was a great session. It seems like a lot of communities are moving towards asset management. But I swear it must have been Ron Vincent up there teaching the class, because it's the same thing we've heard from him. And I really enjoyed that session. This wasn't on the agenda, but we asked for AML's help. I have that group called the Port Communities of Alaska, where it started as a COVID thing. And what we were doing as cruising came back post-COVID. That has since turned into it's us, it's Ketchikan, it's Juneau, it's Skagway. That group is starting to grow on this regional tourism discussion. So we're asking AML now for help so we can better organize. And we use the Alaska Remote Seller Sales Tax model as an example, and asked the AML, could you help us? Where are we? What do we need to do? How do we need to get this going? So I'll have some more information for you soon on what we're going to do about that and how we can get AML's assistance in some of the tourism issues. We had a sidebar meeting with Alaska Housing Finance over some affordable housing initiatives that they're working on. Still have a lot to learn there. We'll be talking about that soon in a future assembly meeting. I was able to talk to attorneys from the city of Juneau and from Washington State on labor negotiations and best practices. I talked about some things that can be challenging dealing with bargaining units, and I kind of got laughed at and said, you're not the only one, John. That happens everywhere. So they gave us a good course on what best practices are and how we can have a mutual working relationship. I attended a very popular one, the base student allocation and evaluating the cap. But I did hear from Heidi Teschner, the deputy commissioner, that because we're exploring taking over maintenance and spreading it out, because they are school buildings or city buildings. And the question is, if we perform that function, does that count towards the cap? And I was told no, that if us taking over maintenance does not count towards the cap. I think Juneau's going to run with that as well. They heard it too, so they'll back me up. We talked about implementing the opioid settlement fund. I learned this. I didn't know there was an opioid settlement fund for the state of Alaska. Unfortunately, Sitka was not one of the 9 communities that were getting direct funding, but there is a pool of funding that we can tap into for the opioid crisis, and that comes from the Sackler family and the Purdue Pharma, very large settlement there. So I'll be continuing down that route to see what's available for us and if we can assist any programs here. And then finally, I attended a Q&A period about the Alaska Municipal League Joint Insurance Agency and APEI, the Alaska Public Entity Insurance. They are in the process of a merger, so they had just a Q&A session on what that means for the city. So I apologize for the long report, but as the mayor said, it was a very productive visit. Learned a lot of things. We had a lot of notes, and I think it was time well spent there. Thank you.
Brian, if you're online, do you have any report?
Yes, I have been on medical leave much of the past month. I started back working on a limited basis last week. I'm ramping it up this week and beyond. I will be working remotely. Mindy Lawrence, my legal assistant, is covering the office full time and will coordinate contact and meetings with me, and I'm available from now on. Thank you.
Thank you. Liaison representatives. JJ?
I'm pleased that there was 2 more members of Health Needs elected this evening or appointed this evening. So our meeting next Wednesday will be a full 7-member commission. That is very exciting to share. I attended a social determinants of health session when I was at that training last commission committee, whatever, conference, the other C word, last week as part of that kind of week long that I started with newly elected and went through to the overall. I think that social determinants of health needs will really help me with my liaison work for this commission. Some other things I was able to hear and participate in was, just there's so much overlap between Alaskan communities. And we may think that we're kind of isolated or we're doing this by ourselves, but every person I've talked to out there, whether it be a clerk or administrator or another assembly member or a staff member or someone at a booth that was sharing a service with the group, that school funding, housing, food security are universal challenges in the states. And it was kind of heartwarming to know that we're a small state with people, but a big state and land, but we are also kind of all struggling. So it's not heartwarming, it's heart cooling at the same time that we're all having these same challenges. But knowing that there is a group out there like the Alaska Municipal League that is behind us, and our list of initiatives was over 20 that we came together to come out, or the mayors came together to put out there, is like we're doing the hard work together, and we've got a great organization making it happen. So thank you for trusting me and giving me that opportunity to go up there and participate in that training. I think it was very valuable to kind of kick off my elected role here with that kind of solid backing. Mm-hmm.
Chris, you got anything on this one?
No, not really any liaison stuff. I guess I would like to say something to the assembly. Kind of some big news that came out today.
Reports at the very end here then.
Oh, yeah. All right. Yeah, that's fine.
Perfect. Thank you. Any other liaison representative reports? Sarah?
All right, our next regular assembly meeting is Tuesday, December 26th. And then we also have a number of vacancies on our boards and commissions. If folks are interested, they can contact our office.
Thank you. Any other reports this evening, Chris?
Yeah, so today kind of some big news came out in the fishing industry. Trident Seafoods is looking at selling multiple plants all around Alaska. I know it doesn't directly affect us because we don't have a Trident Seafoods here in Sitka, but it is really concerning for the fishing industry that such a big player like Trident is pulling out and basically not wanting to do anything with salmon. And that's a huge part of our economy. And it's going to show the volatility in that sector of our economy right now. So yeah, I just thought everyone should be aware, and yeah, kind of concerning news.
Yeah, I appreciate the relay on that one. Any other reports this evening? Seeing none, that would bring us to our executive session.
I move to go into executive session to discuss the status of the municipal attorney, matters which by law, municipal charter and ordinances are required to be confidential.
Second.
It's been moved and seconded. Is there any public comment about entering executive session? Assembly deliberation. Sarah?
All right, on the motion to go into executive session, Mayor Eisenbeis,
Yes.
Mr. Yestad,
Yes.
Mr. Mosier,
Yes.
Mr. Celine,
Yes.
Ms. Carlson,
Yes.
and Mr. Pike.
Yes.
The motion passes 6-0. We'll be meeting in room 4. Brian and Chris, you'll need to leave the current meeting, and then I'll go into the executive session room and set up a new Zoom meeting, which you will dial into.
Will do.
I move to reconvene.
Second?
All those in favor say aye.
Aye.
Thank you. We are reconvened as the assembly in regular session. That would bring us to adjournment this evening.
Move to adjourn.
Second.
All those in favor say aye.
Aye.
We are adjourned. Thank you, assembly, for your time this evening on our lengthy meeting.